Hello.
Dal tadka with organic brown rice
Okay, very specific, but okay. Is it a solo trip or you're traveling with ma'am?
with wife.
Okay. Hello. I'm Dr. Sonal Kadu, the head of programs at Cedar, and it gives me immense pleasure to welcome you all to the Professionals Podcast. Today's podcast is in kind collaboration with our partners, the Smile in India. In this series of podcasts, we will have candid conversations with our Cleft professionals from all different interventions. And for our very first podcast, we have with us renowned plastic surgeon and my personal favorite, Dr. Nitin Mokal. Hello, sir. Thank you for joining us.
Yep.
Lovely time, by the way.
Thank you.
I am very intrigued to know what inspired you to specialize in cleft plastic surgery.
Way back in 1987, when I joined my plastic surgery training at Lokmanya Tilak Municipal Medical College, we call it as a Sion Hospital. And our plastic surgery department used to have good amount of cleft cases. Gradually, I got exposed to these cleft patients. I see their progress. I thought it is a good specialty, and that is where I started developing the interest in cleft surgery.
Can you, sir, share a memorable case that shaped your perspective or your career?
After my marriage, my mother-in-law brought one child, and he had a cleft lip, cleft palate. And I managed to operate on him as a cleft lip patient as well as a cleft palate patient. And then over the period, he was sent to orthodontic colleague, Dr. Chintamani Kayat, and he aligned the teeth nicely. And we have decided to plan for alveolar bone grafting.
Okay.
But this child had got some element of a lip deformity as well as a nose deformity. In the schools, that this kid was teased as a flat nose patient. So he was quite mentally disturbed. So I went through the literature and I found an article by Dr. Ortiz Monasterio. He is a renowned plastic surgeon from Mexico. He used to do cleft rhinoplasties in a pediatric age group when the child is around 8 to 10 years of age, where he's in the transition from puberty to adulthood.
Okay.
I thought doing the alveolar bone grafting as well as lip nose revision at the same time will be a great opportunity to give some aesthetic improvement in the child for the psychological improvement and the confidence in the child. So we did about series of cases with the combined technique, and we have got a very encouraging results. Now all these patients are now 28, 24 years of age, showing a good skeletal development as well as aesthetic result. Now over the period, the child has grown up. He became an IT engineer. He's very confident. His speech is extraordinary. His profile is good. So only with 3 surgeries, lip repair, palate repair, and alveolar bone grafting with lip nose revision simultaneously, has given a encouraging result.
So with cleft, there are a lot of myths and a lot of misconception about cleft and cleft surgeries in general. So what are some of those myths and misconceptions?
There are some misconceptions. That first one is that where people say that this cleft can be fixed with only one surgery.
Right.
This is a myth, because most of these patients, they do require secondary surgeries because soft tissue healing, skeletal healing, it is not proportionate. So these are the patients, they do require multiple surgeries. The second myth is that whether this can be done at a later age group. In a later age group, more you wait, more the secondary deformities will occur, because there are certain deformities, they do occur if you don't operate upon, like the speech will not develop properly, the middle ear function will not develop properly, so the patient may get developed deafness, then the skeletal development get affected. So in cleft, you have to operate at a right time, the right age, and the right procedure. Another myth is that people feel that it is a cosmetic surgery.
Right.
It is not a cosmetic surgery, but it is an aesthetic surgery. You are going to give the patient a normality. You are bringing all the anatomical landmark to the normal position, and it is a reconstructive surgery. You are reconstructing the nose, you are reconstructing the nostril floor, you are reconstructing the oral musculature, You are reconstructing the palatal musculature to give a good speech results. You are reconstructing the bony defects. So it is more of a reconstructive surgery, but with aesthetic intention. You want to make the child as aesthetic as possible.
The cleft is detected in the antenatal with the new parents when they first hear that the child has cleft. After the OBGY, after the gynec, you are the first medical professional that they meet. So what are the first words that you say to this new parents? Because I believe that the first words, the very first sentences hold a lot of incredible power. So what are those first things that you say to these new parents?
I will tell these parents that the cleft is treatable. It is none of your fault.
Right.
Now we have to concentrate on treating him, and we want you to get involved in good, tender, loving care for the child. And we are there. We have a team of specialties, including the orthodontist, speech pathologist, the surgeon, the mental health supporters. Plus, there is organizations like Smile Train. They provide free services, free operations for comprehensive cleft care. You don't have to worry. If it is coming into the antenatal period, I will encourage the mother to enjoy the pregnancy, go through the pregnancy like a normal pregnancy, and then prepare herself for the delivery of a cleft baby, and then other feeding advice I will give. The other feeding advice like a breastfeeding, that in different positions of breastfeeding. There is educative videos are available online on our Smile Train website, that how to give breastfeeding in a cleft child. And multiple varieties of bottles are available. That bottle feeding can be encouraged. And mainly all the supportive staff in the hospital, in the house, mainly all senior members of the family, especially the grandparents from the mother's side and father's side, to give them that you have to be with the parents and support them emotionally as well as physically.
So can you walk us through the typical timeline of the cleft surgeries?
When the baby is brought as a newborn baby, in the first 24 hours, we have to tell the mother to teach about the breastfeeding. Then if the breastfeeding is not possible, if the milk is not adequate, then the top feeding and the bottle feedings, different types of feeding bottles. Then I'll refer him to a pediatrician to see how is the growth chart is maintained. Then at 4 months and 5 kg weight with adequate hemoglobin of 10 gram %, we will operate upon his lip.
Right.
The lip repair involves the lip repair, the anterior palate repair, as well as the nose, nostril base and the primary nose correction. These are the three parts we do it at 4 months of age.
Right.
Then after the lip repair, again the child is been monitored by our pediatricians about the growth and the nutritional support which is required. At 6 months we can start on a weaning, so different weaning foods to be given to the child. And when the child becomes about 9 months of age, with the 8 kg weight, again good hemoglobin, we operate on the cleft palate repair. The cleft palate, the intention is you have to repair all those palatal musculature to its new position, which will restore the speech function. And after the palate repair is over, then the child has been referred to a speech therapist to do a speech assessment and regular speech therapy for about 5 to 6 years of age.
Right.
Then when the 6 years of age, then the child will go into the mixed dentition. So permanent teeth starts erupting, and we refer that patient to orthodontic colleagues to align the teeth, create the spaces to bring down the permanent teeth, and align the teeth nicely so that prepare it for the alveolar bone grafting. Simultaneously, the child also require a psychological support, the child as well as parents. And that is where the mental health people, organization like Sirat will come into picture. Then when the child becomes about 19 to 20 years of age, he may require orthodontic surgery. But in between, if the child's jaw is not growing properly, then our orthodontic colleague might suggest the intervening surgeries like anterior maxillary distractions or entire foot distraction of the upper jaw to realign the upper jaw with the lower jaw. And lastly, the lip nose revision and the nose rhinoplasty to correct his nasal asymmetry and dorsal support.
So, like you mentioned, that there is a team that is required for the surgical intervention, right? From the medical and surgical, the speech therapist, and mental health. So, how do you work with all these comprehensive care professionals?
In the earlier age group, some of the patients they do have a dental caries. Then we may have to refer them for a pediatric dentist.
Right.
Then while they are on the speech therapy, some of the patients do have hearing problems. Fluid into the middle ear, if the palate is not repaired properly, or if there is a breakdown of the palate, then they do develop ear infection because of the incompetent naso-eustachian tube. In that case, the ENT surgeon comes into picture to do a grommet insertion and ENT assessment. Later on, when the complete orthognathic and other treatment is complete, then the patient will require a full mouth rehabilitation and good aesthetic appearance and require a prosthetic rehabilitation. Then the prosthodontist comes into the picture. In between, if the child is not growing well, then he'll require nutritional support. So nutritionists are also important. So that is how all multiple specialties are involved in the cleft care. And luckily, Smile Train encourages all these specialties to be support will be available for this cleft patient without any monetary problems.
Right. I know that you invest your time and energy in psychoeducating the warriors, their parents, their families. So, how important is mental health and counseling throughout the cleft care journey?
Yeah, it's very, very important because these parents, when they come and see the child having a cleft deformity,
Right.
They are really shocked. And then we have to convince them that this is very common deformity. It comes as 1 in 800 live births. And it is not your fault. It is treatable. So you require to give a tender, loving care to this particular child. And there is a team with you,
Right.
which will take you throughout the journey of this cleft child in the treatment available. So that is how we take the inform the parents about the psychological support, involve the support system like a CIRAT, which is a cleft support system for the parents, involve all the grandparents, as well as show them, introduce them to a child, to a parents who has got already a cleft child and how they are coped up with the continuous treatment of this particular child. You can share the telephone numbers, you can share the photographs, show them the photographs, how the child before and after, and that is how you can overcome their emotionally. They will have a good bond with the child and they will be very tender, loving care will improve in the journey of this particular child. Second part is that they should be prepared for the medical treatment of the child. At regular interval, you have to monitor the progress of the child. Support system is available. The support system both emotionally, medically, irrespective of the cost required, because Smile Train provides the free services for the treatment of this particular child.
So, with the partnership with Smile Train India, we are able to integrate with CIRAT and the partnership with Smile Train India. We are able to integrate the psychosocial support in every stages of cleft. So, when a patient approaches, a new parent approaches, we are able to give them maternal counseling, family counseling, lactation and feeding, and it goes up to family counseling and then career counseling as well. So, how do you think this has changed the whole journey of for a warrior?
Yes, it is so much supportive that at every level you are supporting the child. Some of the children, they undergo depression because of the bullying from the subordinates. Some of them are not confident because the speech is affected. Some of them are not confident because they have a scar on the lip, they have a scar on the nose. So all these patients, we have to make them not only aesthetically good, we have to improve their function in terms of the speech,
We can improve their profile by doing the orthognathic surgery, so they become more confident, and you make them as natural as possible, as lively as possible, so that so that they can develop their hobbies, they can develop their career. Some of my patients are computer engineers, IT engineers. Some of them, the speech is so good, they are good in Sanskrit. So you have to support these patients at every level, and we have got luckily the support system to treat these patients.
Right. So every time there's a patient who requires counseling, a warrior who requires counseling, or a parent who requires parental counseling, you've always very graciously referred it to Seerat. So apart from referring these patients and warriors to Seerat, how else do you ensure that these parents meet, these warriors meet, and they exchange information and they connect with each other?
I have phone numbers of all the patients
Okay.
uh, with the name and from where they come from.
Right.
And we have a free Smile Train OPD on Wednesdays.
Mm-hmm.
So I call them at only one time.
Okay.
My time is 12 to 2, but everyone call them at 12 o'clock. Then they interact with each other. They see the results.
Right.
Result of my child. Now he's grown up.
Mm-hmm.
Then they exchange the idea. They they talk to each other about the doctor. They talk to each other about the hospital, the service providers, and other things. That is how they mingle with each other.
Right.
And just seeing the results. So like if I got the good results, my patient is my brand ambassador.
Right.
So that
Very well
patient
said.
itself is a good example for the younger parents to see that my child is under safe hand.
Right.
They are in the safe team of people
Mm-hmm.
who are going to take them to a journey till the 22 years of age.
For the last question, sir, if you could change one thing about Cleft Care ecosystem tomorrow, what would it be?
I would like to change two things.
Hmm.
First is the preventive aspect of the cleft.
Okay.
That you plan everything. You plan your marriage, you plan your housewarming, plan everything, but you don't plan pregnancy.
Right.
You should plan your pregnancy in such a way that both husband and wife both should be mentally and physically healthy to undergo pregnancy, to have a normal baby.
Right.
So you have to take medicines like vitamins, B12 and zinc, have a normal healthy lifestyle, avoid drug addiction, avoid alcohol, avoid smoking. And all this message should be given to all the younger generation. Second part I would like to change is that every cleft patient should have access
Right.
to the comprehensive cleft care. This comprehensive cleft care should be made available to all the districts where the child or parents can easily access to it without any cost. That should be the intention.
Very rightly said, sir. This has been a very insightful podcast, sir. Thank you for your time and energy and gracing our very first podcast with your presence.
Yes.
Now, for the fun element, sir, I think there was a lot of serious discussions happening. I'm sure our viewers will take away not just information, but a lot of encouragement and hope. But now to the rapid fire round. Are you ready, sir?
Yes.
These are fun one-liners, sir.
Yes.
So, if not medicine, what career would you choose?
Agriculture, horticulture and farming, mainly the natural farming.
Okay. One food you could eat every day without getting bored.
Dal tadka with organic brown rice.
Okay, very specific, but okay. What is your dream travel destination, sir?
Mediterranean countries.
Is it a solo trip or you're traveling with ma'am?
With wife.
Okay. If you had a superpower for 24 hours, what would you choose?
I would like to treat all the kids with the antenatally having detected congenital deformities.
Very
I will
beautiful.
heal them completely so that they will born as a normal baby.
Very beautiful, sir. Last question, sir. If you wrote an autobiography, what would be the title?
The title will be Niti Moksha.
Wow, okay.
It contains my name. Niti means Nitin and Moksha means enlightenment. So use the live ethically and achieve the freedom or enlightenment.
Phenomenal title for the autobiography, sir. That was a very interesting rapid fire, sir. I am sure the viewers had a lot of fun and information. Thank you for your time and your expertise and for wearing your heart on your sleeves. Stay tuned for more episodes.